Foster. So I'm doing an impromptu talk today. It is Friday, and we are going to talk about how to breathe better naturally. We're going to talk about parasites. We are even going to slightly mention measles and whooping cough. So just to start off, we have a new formula. It's called Lung Support. Lung Support is here, and it's made up of various herbs for the lungs. I recently was reminded of a story where one of my first patients was a man who was in a coma who had pneumonia, and he had been given 4 types of antibiotics and he had failed treatment. So what I did at that time was I used lung herbs like the ones that are in Lung Support, and I gave him cayenne pepper directly in his G tube, because when you're in a coma you're unable to eat, so normally you have tubes going everywhere. So within the first dose he started coughing up phlegm, and probably within about a week he was cured from his pneumonia after all the antibiotics had failed. So I of course have had lung issues of my own. I grew up with asthma. I was taking 4 kinds of asthma medications, antihistamines, decongestants, so I was very familiar with the lung issue, and I wanted to have something for people that have these chronic issues. I do have a formula called Herbal cough syrup, and I like that formula, especially during cold and flu season, but it does have honey and glycerin in it, and some people, if let's say they have candida overgrowth or if they're diabetic, they maybe don't want to take anything with sugar in it. So the Lung Support has specific herbs in there for the lungs. And for those of you that don't know me, I'm a conventionally trained medical doctor. I went to University of Texas. There's the diploma. Here's my book, Stop the Medicine. I left medicine over 20 years ago because I had seizures. I went to various natural healers to get my cure. So I have been completely cured for 20 years and have not needed any medication for that. So and that was quite a feat, because I was having 2 seizures a day, and it went on for about 4 years. So it wasn't just a simple seizure. So, and I also have been known to stop people's asthma attacks, sometimes with lobelia tincture, and other times with an essential oil that's called ALRG, which I will bring up in a moment. So I want to start with Lung Support, and I want you guys to really understand what these herbs do, and that it's important to know all of them instead of this mentality of you take this one herb if you have this one thing, mainly because your body's connected on the inside. So the important takeaway for today is that your large intestine is connected with your lung function. So recently I was on social media, and these people were debating back and forth. Oh, what would you do for this? What would you do for that if you were sick? Oh, I bet you would go to a medical doctor if you got pneumonia. And so this person was chiding me a little bit, and I was laughing because I know all kinds of natural treatments for pneumonia, and so they were thinking they were going to get me, and they said, well, wouldn't you take antibiotics if you got pneumonia? And I answered her, no, I would not. Now this may not be the answer for you, but this is the answer that I have come to over the many years that I have treated patients and experienced healings in my lungs for myself. So in order to know how I got there, I would like to share that information with you. So one of the most important things for pneumonia, first of all, nobody gets pneumonia like that. It usually starts with getting sick. So it sometimes starts with getting the flu. It could be a person that continues to get sick with lung problems. And one of the issues with that is when you use antibiotics, and I'm not saying that's always wrong to use antibiotics for pneumonia, but when you use antibiotics, you're killing things. So you're killing bacteria, you're killing viruses, or whatever it is that the doctors have determined is the cause of the pneumonia. But you're not helping your body eliminate the waste. So you've got white blood cells that go in there and they kill the infection. And even though you may kill the little bacteria, you're not getting rid of the mucus, the phlegm, the pus, everything, the mucus and things that are part of that infection. And in order to do that, you need to do certain things like clear out your colon and stimulate the circulation, and take some herbs that have a natural expectorant quality to them. So killing an infection is not simply about taking the one thing that kills that bacteria. It's about healing your body. But if you know how to do it, you can do it well, then you will never be afraid of these things again. So we're going to start. And just a reminder, I can't see any comments right now, but if you do have questions, please feel free to write those in, because I will get to them after the live is over. I know it's Friday, so some of you are probably out having a great time. So great. I tried this formula for the first time after I had inhaled some diatomaceous earth. So I had a pest control issue, and I was laying down the diatomaceous earth in these cabinets, and I wasn't wearing a mask, and that's a mistake. I will tell you now, that was a mistake, because what happened was that I started coughing violently, and it didn't go away, and days went by and it didn't go away. And I had just gotten the lung support formula, so I started taking it, and it wasn't very long until the coughing and everything went completely away. It did take a while, which is important to know, that sometimes when you've done something, to continue to take the herbs even past the point where you feel well, just to be sure, and especially, although it didn't apply in my case, especially if it was something infectious, keep taking the herbs for a little while longer to make sure that you've killed everything. Okay, so diatomaceous earth. Oh, and this also reminds me, because I had another friend of mine who inhaled fiberglass from his air conditioner in his car. There was fiberglass in his engine, and it broke off and it flew through the vents, and he was inhaling it for days and days and days and didn't realize. So he had severe asthma at that point, and he went to the doctor, and the doctor said, you know what, there's nothing you can do, because you've inhaled fiberglass and these particles are too large for your body to eliminate them. And so this is the part where I said, look, I'm a natural healer. I've seen all kinds of things healed, and do not be intimidated when a doctor says you can't eliminate something. Your body is capable of amazing things if you know what to do, if you know how to support and work with your body, work with the juice fasting and the colon cleansing, which is exactly what I did for him. I put him on a juice fast, and we started doing essential oils on his chest and his back, and we did the colon cleansing, the vibrant colon, which moves the colon detox caps. This pulls out toxins from the bowel, and that, believe it or not, clears mucus from the lungs. It can clear fluid from the lungs. So talking about fluid, the first herb we're going to talk about is pleurisy root. So pleurisy root is not a well-known herb, and this book is David Hoffman's book. He's a European herbalist. So those European herbalists are very knowledgeable about using the herbs. They're probably more comfortable using the herbs over there in Europe, because over there it's more socially accepted. So they are very familiar with using essential oils and herbs, and a lot of the doctors over there even recommend them, and they're sold over the counter. Even for internal use, they have essential oils to take internally if you've got a lung issue or a cold or the flu. So pleurisy root, the Latin name is Asclepias tuberosa. It is the root that we're using, and I'm reading the indications here. It is effective against respiratory infections, where it reduces inflammation and assists expectoration. So that means it helps you cough this stuff out, which is what you want. It can be used in the treatment of bronchitis and other chest conditions. So those of you that have chronic bronchitis, listen, this is a great herb for that. The addition of diaphoretic and antispasmodic powers. So diaphoretic is a very important function for an herb, because it causes a sweat. So again, when you're sick, you want to get this stuff out of your body. So sweating is one of the ways your body uses to get rid of toxins. So when you're sick, a sweat can be very therapeutic and very important, and especially if there's a fever. A diaphoretic is a classic herb to use for a fever. Antispasmodic. So when you're struggling to breathe, what's going on is these bronchioles are in a spasm, right? And what does an antispasmodic herb do? It opens, it releases. And what happens to your breathing when you release a breathing spasm? The wheezing goes away. People are able to take a deep breath. People can breathe clearly. So pleurisy root is called that because pleurisy, if you don't already know what it is, it means that you have accumulated fluid in your lungs. Fluid in your lungs can either happen from an infection, or it could happen if you have an autoimmune disorder such as lupus. So let's see, what else? This is highly valued in the treatment of pleurisy and pneumonia. And it can also be used in influenza, which is the flu. So amazing information. Now we're going to take a look at PDR for herbal medicine. So this is a little bit of an old version, but it does tell you what to do. I don't necessarily like it so much because it says unproven uses, and then if you go on PubMed and look up the same information, it shows you the research study that shows it actually works. So, but there is a little bit of good information here in the PDR for herbal medicines. By the way, if you're not familiar with the PDR, this is short for Physician's Desk Reference. So typically doctors use the PDR for medications, and it tells them all about the medications that they're prescribing, the dose, the contraindications, what it's used for, the contraindications, so the cautions, what side effects it might cause. So, so the PDR says about pleurisy root that it is said to act as an expectorant. So again, an expectorant, a tonic, a diaphoretic, and antispasmodic. So this is the same information from a different source. So we're very familiar with what this herb does. Let's see, also can be used as an analgesic. So if you're coughing and you're in pain, it helps to ease pain. Also eases breathing. Okay, so that's all we need from the PDR. Now we're going to go into Dr. Christopher's teaching, but Dr. John Christopher wrote this book, School of Natural Healing, and he talks about all of the American herbs that grow in the U.S. And in North America. And he also talks about pleurisy root. The North American Indians consider pleurisy root to be one of the great white father's best gifts to the children of nature because of its specific action for the lungs and for all chest complaints, including pleural bronchitis. It assists expectoration, again, coughing this stuff out, subduing inflammation, so it's an anti-inflammatory, reabsorbing moisture from the tissue. So this is referring to astringency, or what this means is that it dries up the phlegm, which is a lot of times what you want, because you don't want it just running and running and running. Okay, so it reabsorbs moisture from the tissues, exerting a mild general effect upon the entire system. It is one of nature's very best herbs for pulmonary catarrh. This is like an old-fashioned word for mucus and phlegm. So it helps to get rid of this. If you're having difficulty coughing, a lot of times I used to see this when I would do my rounds in the hospitals. I would see older people struggling to breathe and so weak that they couldn't even cough this stuff out. A lot of people die in the hospital from pneumonia and they have no recourse. If the antibiotics don't work, then they often die. So it is, and it's unfortunate because there is something called percussion therapy where using vibration on the back can help these people cough this stuff out. Okay, it also influences the skin and circulation by relaxing the capillaries, relieving the heart and arteries of undue tension. Now, this is a very important point because a lot of times if you're having a breathing difficulty, you get put on the inhalers. What happens with a beta agonist inhaler? That beta agonist stimulates beta receptors not only in the lungs to help you breathe, but also in the heart. And so what happens with a lot of this stuff that's sold over the counter, such as pseudoephedrine or the asthma medication is that you get a rapid heartbeat or you get a rise in the blood pressure. And so this is not a good thing for people that have lung issues, is that, you know, this makes them feel anxious and they get a rapid heartbeat. So Pleurisy root does not have this effect. It actually has a relaxing effect on the heart. So you can relax and maybe even sleep and rest and get well. So it influences the skin, stimulating a slow and steady perspiration so that excessive heat due to congestion in the skin is gradually eased. So this is another point, is that the herbalists are talking about heat in the body and how to release it through the use of a diaphoretic herb, or an herb that causes a sweat. Okay, I am getting like so technical here. All right, so the next point here is Dr. Christopher also talks about many formulas for whooping cough. So a lot of people think there are no remedies for whooping cough. The only thing that you can do is go to a doctor or perhaps get an injection. He talks about using thyme and mistletoe. This was just one of the remedies that he lists for whooping cough. There is also an essential oil gargle that he recommends for whooping cough. You could use any sort of antispasmodic herb for whooping cough, including lobelia, which is a classic lung antispasmodic that will help these kids breathe. Okay, what else? Elecampane is also in this formula. This is a classic herb for the lungs, also an expectorant. Carminative. So carminative means helps your body expel gas. So you may imagine that if you have accumulated gas in your system, you may have more difficulty breathing, which does happen. So, and also a reference to the fact that these herbs do more than one thing. So carminative, diaphoretic, tonic, diuretic. So it stimulates urination so that you can, sorry, the light's in the wrong place. Okay, so alterative is a very important herb because it helps to reverse certain disease processes. Antiseptic, so kills germs. Astringent, dries up mucus. Gently stimulant, stomachic, so helps your stomach. Emmenagogue, that helps the women's hormones. Antispasmodic, antiscorbutic. This is a reference to the fact that they used it for people that had a vitamin C deficiency, so scurvy. Anti-asthmatic, so they knew this herb was good for asthma. They used Elecampane for asthma. A vulnerary, you can even use this herb on your skin if you have a wound, a cut, or an abrasion. Anti-venomous, some people make fun of this, but don't laugh. If you get bitten by a snake and you take the herb and it works, then nobody's laughing. We're all just happy and relieved. Okay, Elecampane helps with all pulmonary and catarrhal problems. Its sodium phosphate content cleans the liver and digestive organs. So again, we are not just working on the lungs, we're working on various organs of your body at the same time. The potassium chloride content dissolves the fibrinous exudation and mucoid matter. Its calcium chloride content supports, feeds, and tones the heart muscles. So again, this herb is good for the heart and won't give you a rapid heartbeat. And why is this important? He's talking about some of the nutrition in herbs, the nutritional content. What a lot of people don't understand or realize is that herbs do contain vitamins and minerals. Okay, medicinal uses: cough, asthma, bronchitis, all pulmonary complaints. Dyspepsia, so even if you have an upset stomach, this herb can help. Acute catarrhal affection, this means a cough or cold or flu. Dyspnea, what this means is that you're having difficulty breathing. Wheezing, cystitis, which means a bladder infection, skin diseases, inflammations, putrid sores, cankers, rash, tooth decay, whooping cough, dropsy, which is the old-fashioned term for congestive heart failure or a weak heart, so that the person collects fluid in their lungs and other parts of their body. Okay, kidney and bladder stones, retention of urine. Okay, it goes on and on and on. Malnutrition, rickets, muscular weakness, Okay, let's move on to an herb that's called Horehound. This is Maribium vulgare, and this is also a classic herb used to help the lungs. Expectorant, again, tonic, stomachic, diaphoretic. So we've got the same actions here. These herbs help you to cough this stuff out. It is a bitter, which helps your liver, slightly diuretic, aromatic. Hepatic means that it helps protect your liver. Resolvent, okay, stimulant, cathartic. Cathartic means it helps your body get rid of toxins, okay, and helminthic. So what this means is it kills worms. We're going to get to that in a little while. Kills worms. Vermifuge. Vermifuge means it pushes worms out. Fuge means to get rid of, or it's pushing them out. And it is also a spice. It is taken most frequently in a cough drop form. It is quite effective for all pulmonary complaints. It will promote a profuse perspiration. So if you take these herbs and you sweat, that's good. That's a good sign. You're starting to get this stuff out of your system. Okay, it has been highly valued as a soothing expectorant for at least 350 years, and he's giving a reference here to Culpeper, who is a classic herbalist, wrote that it helps to expectorate tough phlegm from the chest. So that means when the phlegm is kind of sticky and you can't get it out. My goodness, so much sun today. Okay. So it's good for hoarseness, cough, asthma, pulmonary problems, croup, chest colds, congestion, jaundice, expelling of worms, chronic sore throat, tuberculosis even they knew these herbs helped with, difficulty breathing, suppressed urine, stomach ache, intermittent fever. So a lot of these herbs help fever, even though this herb is not classically known as a fever herb. So we're going to go into another herb, which is licorice root. So licorice root is well known because it tastes sweet, but it does a lot of things in the body. We classify it as a demulcent herb. So a demulcent herb is something that is very soothing. So this is what it says. Licorice is very soothing and softens the mucous membranes. So in your lungs and your sinuses, you have a lot of mucous membranes. And if you cough or you have a lot of congestion, this can get sore. This can get painful. And so that's one of the reasons why we use demulcents. At the same time, it helps cleanse mucus. And I'm paraphrasing here. It increases the flow of saliva when slowly chewed. It acts, when you stimulate the saliva, it helps to soothe a sore throat. It is one of the oldest, mildest, and yet most efficient laxatives. It is a mild laxative that is good for kids. It often soothes, softens, lubricates, and nourishes the intestinal tract. Some people may know of licorice root as a good remedy for stomach ulcer because it helps to repair that stomach lining. Wild cherry, I think we've already covered, so that's all for Dr. Christopher. This is an amazing book. So now we're going to move on to another David Hoffman book, Medical Herbalism. Medical Herbalism, I'm bringing this page to your attention because he's talking about the natural treatment of measles. Trying to get away from this sun here. The natural treatment of measles. And what do you do here? Diaphoretics help to ease a fever. So remember when I talked about when you have a fever, you take something to make you sweat, and that is getting the heat out of your body, and that helps bring a fever down. Antipruritics to relieve itching, demulcent expectorant. So this is everything that we're talking about if there's a cough and what to do. Eye strain due to photosensitivity. So when you get the measles, your eyes can feel quite sensitive. A lot of doctors recommend that the child stays in a dark room. There are herbs that you can use for the eyes, including eye bright. Eye bright can be used as an eye wash if you dilute it and put it in an eye cup. Those herbs can also be taken internally. Okay, hey everybody, it's Dr. Foster again. I'm so sorry we had technical difficulties, but I'm back. I have a couple more things that I'd like to share with you about how to heal your breathing naturally. We already talked about cleaning out your large intestine. We talked about various herbs. We talked about essential oils. We talked about the cough syrup. I talked about the fact that even if you've inhaled something that the doctors have told you cannot be, it cannot come out of your system, that don't be surprised. Your body's capable of many things. Even if you've been told it's hopeless, it's not necessarily true. And I want to read a story to you about a patient that went to see Dr. Bernard Jensen, who was a very famous natural healer and chiropractor, and had a ranch in Southern California where people would come from all over the country to heal from things that were incurable, that were hopeless. This was the first book that I had ever read about natural healing. I had severe asthma, had all kinds of breathing difficulties while I was training to become a regular doctor, the one at University of Texas training to become an MD. And so I thought, with everything that was going on, like I said, I had seizures for 4 years, which I didn't even know about. I thought, if I could just breathe, then my life will be better. Then this book will be worth it. So it's Breathe Again Naturally. It's an amazing book, and it talks about not just taking an herb for your lungs, but actually healing your whole body, and your whole body will get well and your breathing will get better because you've harnessed the power of your entire body instead of just taking a vitamin here, a vitamin there, an herb here, an herb there. It's really giving you an understanding of what it takes to heal yourself from something, even if it's really bad. So there is a story in the back of this book that I want to share with you because there's a lot of confusion about taking herbs. I've been using herbs for 20 years, so I've seen everything with my patients. So one of the things that happens is people are not used to taking really strong herbs. And like I said, the lung support formula is a strong tincture. And I use those alcohol extracts because they work fast and because they're concentrated and they're strong. If somebody's wheezing, if somebody can't breathe, you don't want to give them a couple capsules of something because it's just not going to work. So one of the things that happens is that herbs detoxify your body. So things start moving, things start happening, toxins start mobilizing, coming out of your fat cells. They come out of your muscle cells. They come out of your bones even. Sometimes they're coming out of your brain. And so when this happens, people generally may not feel so good. They may think, I've had an allergic reaction to an herb, or I can't take that herb anymore. I can't tell you how many times I have heard this story. So what do you do about that? And how would you know if this was the reaction you had was a healing crisis or an allergic reaction? Most of the time it's a healing crisis, and it's a good thing. So the problem is that people can do a lot of strong healing techniques, do some juice fasting, take some strong herbs, move into a healing crisis, don't know what to do, go to their doctor, go to their medical doctor who has no idea what this is, who simply says this is an allergic reaction. So people are getting the wrong impression about this, and they're thinking they're allergic to an herb, when in reality 95% of the time people were not allergic to their herbs at all. They were having a healing crisis. So what is a healing crisis? This is when the toxins are coming out. It typically happens when you're feeling great, when you've been taking herbs, you've been doing everything right, you've been watching your diet, you've been drinking water, you've been doing exercise, you're taking a strong herbal formula, and then boom, it hits. Oh, you've got a headache, you've got mucus coming out of your nose, or you've got foul odors coming out of your body, or your tongue is coated, or your sweat doesn't smell so great. This is a classic detox. This is not an allergic reaction. What do you do when this happens? what the great natural healers did, Harvey Kellogg, Dr. Christopher, Bernard Jensen, they all said the same thing. They said, focus on your elimination, drink lots of water, make sure your colon's moving. So maybe you're taking an herbal laxative, or taking an enema, something like that. Make yourself sweat so that this toxic stuff can come out of you. Now, what's in there? It could be an old infection that was never resolved, where you took an antibiotic and you killed the germs, but your body didn't get rid of the waste materials. What else is in there? Stones could be in there. Parasites can be in there, and you have no idea, which is going to be a future talk because we're wrapping up today. What else? Pus and things from old infections can come out. Literally, I read one story about this woman who had lice, and she took a chemical remedy that the doctors had recommended, and what happened when she did a really strong cleanse is her whole head broke out in lice again. Why? Because the chemicals never fully heal what you have. They can make the lab numbers look good, they can make an infection go away, but usually what happens is this stuff goes underneath the surface, it accumulates in your body's tissues, and then you don't feel well. Or maybe this is the infection that keeps coming back over and over. Or you just feel weak and the candida is overgrowing in your system, or you just keep getting infections over and over. And it's because even though you can make the lab tests look good, you can make an infection maybe look like it's gone, it's not completely healed. So what do you want to do to completely heal is you want to heal your whole body. So you want to do the good diet, you want to drink water, you want to take herbs, you want to take things that are natural. So this story in the back is a patient from Maryland, and it's kind of a long story, so I'm going to paraphrase, but this is a very typical healing crisis. Again, if you don't know what a healing crisis is, you're going to be scared when you take herbs, and you're going to think something's gone wrong, or you're going to think like, oh no, the herbs are contaminated or something's wrong with them, and that's not what's happening. What's happening is that you're healing, and it's important to understand this healing process. In fact, there's an entire book written about it called The Doctor-Patient Relationship, which you can probably still find on Amazon, and it talks about this exact issue. So natural healers know about this. Usually it's good to get with a natural healer so you know when this stuff comes up. I normally see it in people who have taken a lot of medications, especially if you've just gotten out of the hospital, because you get a ton of drugs in there, and it doesn't completely leave your system. And how do we know this? Because we do a cleanse with people, and this medication residue comes out of their body, where they literally can smell medications that they've taken years before, that have just been sitting in their tissues for years and years. This stuff comes out. Okay, so we're not afraid or scared when this comes out. We know and we understand what this is, and we know that it's part of the healing process. Some natural healers call it unwinding, some call it retracing. It's called a healing crisis often. Some raw food retreats I know call it a healing opportunity, because this is the opportunity you've been waiting for to get well. So here's a story about a patient from Maryland, and again, this comes from Breathe Again Naturally, which was written by the chiropractor Bernard Jensen, who is no longer with us, but healed every possible health issue that you can think of when all seemed to be lost. So this person says, when I first came to see Dr. Jensen in 1975, I couldn't even walk across the room unless I had my asthma inhaler handy. Then I could take a breath and continue walking, again having to take another whiff of inhaler before I was even halfway across the room. Originally, she had met Dr. Jensen through a friend who had suggested his book, You Can Master Disease. When she finally went out to the Hidden Valley Health Ranch, which no longer exists, she was in the process of trying to get off all of the medications that she was on, but was having a really severe drug withdrawal and a very difficult time. She had already decided to get off of junk foods from the moment she arrived at the ranch. So she had decided no more packaged foods, no more canned foods, no more fried foods, and no more quick meals. So no more frozen dinners cooked up in the microwave. Of course, she changed her diet completely, she says. She was taken off of bread. That's that white flour stuff with yeast. It's no good for us. At one time, she thought that if she had a slice of bread with butter and a cup of something hot to drink, that would help her asthma. But in reality, it was actually making her worse. So she coughed up mucus and things after eating these foods, and she thought, oh, this is helping me somehow. But in reality, she did not realize that the bread was creating the mucus and building more problems. So she started eating raw foods. 80% of her diet was raw. She started drinking fresh juices, especially carrot juice, which you see often with Bernard Jensen's recommendations, because he put a ton of people on carrot juice to heal them from everything. The only cooked foods that they allowed her were baked potatoes and steamed beets. The retracing process was not easy. Dr. Jensen told me all about the toxins and residues in my body and told me they would have to come out before I could get well. She remembers his lectures on the right mental attitude. So they brought up the fact that you cannot get well if you're angry or resentful. And this proved really helpful in trying to change her attitude. She had made up her mind she was going to be the best patient that he had ever had because she was so sick and tired of being sick. She says it took about a year, though, to get well. So if at first it doesn't work, you need to keep going because there's great stuff ahead. So this is what she learned. She's talking about her history and saying she had an operation on her lungs. She was so severely ill in her lungs. She was coughing stuff up every day. Just paraphrasing here so you don't get grossed out. They took all kinds of tests and x-rays. They poured oil down her nose, took a picture of her lungs, told her she had something called bronchiectasis, which is a severe diagnosis, which is basically you're going to have an infection constantly in your lungs and constantly be coughing stuff out. So they at that time said, let's cut this section of your lungs out. And she says, I didn't know any better, so I had a section of my lungs cut out. And she says, I wish I would not have done that had I known that this could be healed naturally. So what happened was 26 years ago, she's saying after that operation, that's when she developed asthma. So then she had asthma every day, and she was struggling, and she was having to use the inhalers. And she says, my life was centered around going from one doctor to the next. One winter, I had 5 different cases of pneumonia, in addition to the asthma, and this was all in 1 year. So you see, the operation did not cure a thing, she says, and neither did any of the drugs I was taking. They did not relieve anything because I still had the asthma. I went on to have even more medications and even more health problems. One of the conditions she had was colitis, so she didn't just have a lung problem. So again, your large intestine is related to your lungs. So if you have a colon problem, you may also have a lung problem, and vice versa, because these organs affect each other and you need to heal both of them if you have a lung problem. She had colitis for 10 years before she went to see him, and she was unable to have any raw foods, any raw salads, any raw fruits or vegetables, and she missed them so much because everything had to be cooked. When she arrived at the ranch, he put her on a new diet, and she goes, I'm not going to be able to eat this. I have colitis. And he said, let's just take it a day at a time. To her utter amazement, and Dr. Jensen was a big advocate of colon cleansing. So he would have them take colon cleansing formulas. Again, like I said, vibrant colon, getting your colon moving and having more than one bowel movement a day, colon detox caps, pulling out the toxins in your bowel, such as the heavy metals, the radioactivity, the harmful bacterial toxins, the inflammation, the stuff that's sitting in there that's causing your colon to be inflamed. And then he would teach them how to do enemas and things. So, to make a long story short, she was completely cured of the colitis and never had it again. She could then eat all of the raw fruits and vegetables that she wanted and drink all of the juices. And she's saying, not only did it work for me, but my husband came along and it did all of these things for her husband, who had a heart condition and a bladder condition for which he had taken a lot of antibiotics. And he had a great deal of arthritis, the beginnings of a prostate condition, and a couple of spells with high fevers. The arthritis especially was troubling for him, and he would often take 8 different pills a day for it. So when she went to the ranch, she learned many things. So she would write her husband, and he would put those things into practice. One of the things he did was stop drinking coffee. He also stopped eating citrus fruits because Dr. Jensen had said they are normally picked green. He also says in some of his other books that those immature fruit acids can irritate the bladder. So if you have a bladder issue, then this is a great point. Her husband no longer has a heart condition. At that time, he was taking 3 different drugs for his heart problem. He had fibrillation of the heart, which was very frightening. His pulse became so wild and erratic we couldn't even count it. They had to rush him to the hospital, where they gave him an IV and drugs to slow down his pulse. But since he started following the dietary recommendation and doing the cleanses, he no longer has a heart condition or a prostate condition or the arthritis. She returned home after this time at the ranch, but she says, I can't say that my difficulties were over. So again, she was much improved, but she needed to still kind of work on it. So if you're not cured right away, even if it's a month, don't get discouraged. Keep going. Her strength began to return after a period of months, but had a slight fever. In early December, her fever went to 102. She couldn't pee or go to the bathroom. So this seems like this is maybe hopeless, but what was going on was she was going into a healing crisis. So she went to the doctor. All of the tests were negative. No infection. The doctors were puzzled. Started developing pains. Again, this is all part of the healing process. And just to make a long story short here, she had a little bit of an abscess, and foul odors started to come out of her. So again, if you didn't know what this was, you would probably panic. She was sleeping fitfully. She knew her bladder was fine, but she didn't understand what was going on. It was pretty foul. She was only 101 pounds. Finally saw the gynecologist and said, oh, you have an abscess, but we don't really need to do anything for you because it's draining. So he says, let's give you some antibiotics for that. So she says this was a terrible mistake. She took 1,000 milligrams of the erythromycin for 4 or 5 doses and became severely ill. She felt as if she couldn't get enough air. She decided that she was going to stop taking the medication. And yet, these foul odors, this discharge kept coming out of her. And her doctor said, well, don't worry, nature's wonderful, this will come out of you. She felt like at one point she reached a turning point. Her appetite finally improved. She gained a few pounds. Her gynecologist said, you probably had some bowel pockets, diverticula. A lot of people have diverticula and don't know it, and it's because they're chronically constipated. And so what happens? These little bowel pockets collect pus and things, and your food stays in there for a long period of time. It doesn't empty out. It gets infected. And her theory is that these bowel pockets kind of leaked in to a different area, which is what happened. But her body was healing it, and it was coming out of her. All right, and so you're going to think this is terrible. You're going to think like, oh, this is a bad thing that happened. This is actually a great thing that happened, because she was following the recommendations, and she was still doing the colon cleansing. She was still doing the diet. She, from time to time, had aches and pains come up. Hey, your things like your joints are cleaning out. If you have parasites, those are going to come out. She now, after she has gone through that, it stopped. It eventually, one day, it just stopped. She felt well. She gained 20 pounds, and she's now completely healthy. So she went through a process, and that process was maybe a little scary. Most people are not that sick, so most people are not going to have a dramatic story like this. But it is good to kind of know this story, to know that even if your case is severe, you can still get well. I've taken lots of people through cleanses. Sometimes people don't feel bad during a cleanse. Sometimes they feel great. They go, I don't know where I got all this energy. And then sometimes people go, I feel tired, I feel achy, I feel like a little, pain here and there. I feel like I need to go to sleep or take a nap. All that's part of getting these toxins out of you, and all of that is normal for a cleanse. Again, 95 to 98% of the time, this is not an allergic reaction. This is your body trying to heal itself. This is your body going, I want to be healthy. You're finally giving it the right environment, the right organic foods, whole foods, the colon cleansing, the liver flushes, the kidney cleanses. All of those things are super important if you want to get well. So don't be intimidated if you don't feel so great as you're going through the healing process. You can always titrate your doses down. You can always slow this process down so that it's not intimidating. If you get, that's one of the reasons why I like these liquids, because you can reduce your dose by half or by 5 drops very easily. Again, don't be scared, don't be intimidated. People heal themselves of all kinds of things, even in their own homes. So that is the last story for today. Just want to remind you or emphasize to you that whatever it is, you can heal it. And don't be afraid if a doctor has told you something's incurable. There's always something that you can do. There's always an herbal formula. There's always a cleanse. We are going to talk about parasites next time, because evidently I have a big mouth and I talk a lot. So for those of you that were bored, I apologize. Until the next time, everyone, please stay safe, be healthy, and take care. Okay, love you lots. Bye.